Today's topic is about transition cows. So it's an area that we want to address as well as incentive days going on. Let's get a little more production out of these animals, deal with incentive days. So I'd like to introduce Dr. Michael Steele. He is from assistant professor at the University of Alberta. He grew up on a dairy farm in Ontario, so he knows the dairy industry. He's bred cows there, he knows the genetics. He's actually worked, I believe, for a genetic company also. No? Sorry. I got that one wrong. Okay, and a University of Guelph PhD in rumen acidosis. Spent some time in China and also worked as a nutritionist. So, well educated, smart guy. Thanks, Michael.
Okay, thanks.
Sure.
Yeah, so before I get started on the transition cow workshop that we'll be doing, I'll just talk briefly, give you some more introduction to who I am, how I evolved to move from Ontario to Alberta. I've only been here for a year and a half, but it's been a great year and a half at the University of Alberta. But I grew up on a dairy farm in southwestern Ontario, near Woodstock, Ontario. And I have 30 years of milking cows experience here, and here's some proof of that. We used to breed red and white Holsteins too. This is one of the cows that we bred that was champion at Madison a couple times. And if you recall Shormar James, that's another bull that came from our farm. So I thought I was going to become a geneticist when I was really young. But I took nutrition classes, and I ended up loving nutrition. And I knew at that point I was going to become a nutritionist. So I did all that at Guelph. But then I had an opportunity to go to China for a year and consult in the dairy industry. So that was a lot of fun. I have a lot of stories and pictures for another day. But that was a great experience, and I still go back to China frequently. I ended up coming back to Canada. I became the head ruminant nutritionist for Master Feeds. And I was based out of London, Ontario, but I did a little bit of work in Western Canada, but mainly focused in Ontario. Then I went back to the University of Guelph, did my PhD, and it was funded through the Dairy Farmers of Ontario, and this was a great experience for me. I spent another 2 years in industry after this. My focus on my PhD work was really ruminal acidosis, and I'll talk a little bit about that today. This is just images of the rumen wall I took during my PhD of a high fiber diet, then an acidotic diet. So I'll talk about this later on in my presentation. And I spent 2 years working for Nutrisource, which is an international company. The actual brand here would be Landmark. But this was a great experience for me to understand research in an industrial setting, and that was very useful. But my real passion is in academics, and that's why I'm really happy to be at the University of Alberta. So I joined this group. We have 6 of us doing dairy research there. Masahito Oba, Barim Amataj, Lei Luguan, Ziquan Wang, Devakar Ambrose. So we have a lot of bases covered in ruminant nutrition and physiology, immunology, microbiology, genetics, and then reproductive physiology. And we're a productive group. We've published 50 peer-reviewed journal articles last year. So that's kind of how much we put out to the public per year. This is where our research farm is. It's right in the middle of Edmonton. We're the only dairy farm in the middle of Edmonton. We milk 146 cows in a tie stall, and we just do that because it's easier to measure feed intake. We also have a surgical suite, but one of my first projects was putting up a new renovated calf facility, and we're having a calf conference on June 8th to kind of showcase some of these technologies. This is one called a calf rail, where you can feed in individual pens through automation. And this is a group housed area where we can feed water and know what every calf is consuming. We can feed them milk, know the rates of intake as well, how much they're consuming. We get their body weights. We have dry feed intake, so it's all RFID based. So if you want to come and take a look at this, we have a couple, I think at least one bus from Lethbridge coming on June 8th. And it will take place from 10 a.m. to 3 p.m. In the morning, there'll be a workshop that's really hands-on by Jan Zimmerink, who is probably the most knowledgeable person in the world when it comes to practical on-farm automated feeding of calves. And then we have Dr. Jim Drackley, who's one of the most famous dairy researchers in the world, coming to talk about high protein, low fat milk replacers, the differences between milk replacers and whole milk, And then we have Dr. Bob James, who's one of the best technology transfer people in the world, and he'll talk about feeding through automated feeding systems with calves and related to health. And then I'll be discussing more nutrition and also weaning strategies. So hopefully you have an opportunity to come. I think it's going to be a good event. We initially thought we were going to have about 100 people, but I think it's grown to at least 200. And depending on how the next couple weeks pan out, we might even have more. But you're all welcome to come. And you're all welcome to come to the University of Alberta whenever you're in Edmonton area by just sending me an email if you want to see these things on an individual basis. And I receive a lot of phone calls because I'm from Lethbridge area from producers. Because I have been speaking here. I've only been here for a year and a half, and I've only been here twice, but I gave a presentation at Betty Jo's vet conference and met a lot of farmers here, then some Alberta milk workshops. So it's good. I receive a lot of questions from this dairy community here in Lethbridge. My focus in research recently has been calves, but I'm going to talk about transition cows. And I do have an interest in my PhD. I did a lot of work in transition cows, still do some work in this area. The outline of this presentation is just defining what this transition period is, the review of the basics of transition cow nutrition, new topics and research over the last 5 years related to transition cow nutrition, and then some observations that I've collected in the field over the last 10 years that you routinely see. So if you have any questions, you don't have to put up your hand. You just shout out a question or you tell me to stop. It doesn't really matter. I'd encourage you to ask as many questions as possible during this presentation. Or if you're unclear about anything during the presentation, but definitely after, I'll stick around and have a couple beers. So I'll start by defining the transition period. So we all know that when cows enter the lactation cycle, you're going to have peak production at 3 months. They're going to be dropping a lot of weight in the first 2 months. Why are they really dropping a lot of this weight? Any guesses? It's just because they can't keep up to intake. And they don't peak in their intake until about 4 to 5 months. A lot of farmers, people think, and some researchers think that it's over here in 2-3 months, but it's actually around this 3 to 4 month mark. So this cow is lagging behind here, and that's why you're having this severe drop in weight, just because physiologically they can't consume enough feed. This transition period is typically what we define as the dry off period to 2 weeks after calving. This is what the transition period is defined to be. It's divided sometimes into far off, which is about 3 weeks right after dry off, then a close up 3 weeks before calving. But this is a relatively new area of research in fresh cow nutrition. You'll see a lot more research in this area of what to feed a cow as soon as it gives birth. But from this time of 250 days of gestation, so around that dry off, to 4 days postpartum, you're going to have a tripling in the demand of glucose. You're going to have a doubling in the demand of amino acids, a 5-fold increase in the demand of fatty acids, and then you're going to have a 2-fold increase in the flow of blood to the liver and the mammary gland. So you have a whole bunch of things changing really quickly in a very short period of time. And when you consider cows like this, how many people are familiar with this world champion cow? When you have cows like this, and I think in the future we'll have a lot of cows, probably 20 years from now, we'll have a lot of cows that can produce up to 220,000 kilograms of milk in a lot of lactations. These are very metabolically active animals. They're the most metabolically active animal in nature, really. So I like to compare them to high-performance race cars. They are that sensitive to, let's say, any kind of stone on the racetrack or anything. It's very easy for them to crash. And I think that that's a very important thing to consider now, but even so in the future when you're going to see herds averaging around 12, 13, 14,000 kilograms in 305. You actually already see that right now, even some in Alberta. But I think in the future, transition cow problems are not going to go away, and the more that we push production, we're always going to see them. So that's why it's really important to have a good transition cow program. A lot of these cows are crashing in early lactation, and you can see this from this graph. This is from Sandra Godden from Minnesota, where you see the percentage of cows leaving that left in the 21-day periods after parturition, it's always going to be the highest in the first months of calving, after calving. In particular, the first 3 weeks here is always going to be the highest. So the cows that you're going to be removing the herd are always happening in this period. The majority are going to be happening in the first 3 weeks of after parturition. And it carries on even to 21 to 41 days, 42 to 62 days. And a lot of this is coming from inadequate transition cow management. So the transition period, when you look at the economics, if you want to determine how much milk you could potentially be losing, 1 kilogram decrease at peak production is typically, for a good thumb rule, equivalent to 200 kilograms decrease in milk production for the entire lactation. So that's just missing out on that peak. You're going to, of 1 kilogram, you're going to miss 200 kilograms through that entire lactation. But a transition cow problem is typically associated with 5 to 10 kilograms of lost peak milk production. So when you do the math of this, and this is a very conservative figure, you're going to look at close to 1,000 kilograms of lost milk production through this entire period. And this is very conservative, saying that it's $500 lost, and that's just milk production and the price of your milk. It's not including veterinary bills. Does this cow get into calf? Likely not if they're having a major transition cow issue. So it does pencil out to pay very close attention to this transition cow management on your farm. So that's the transition period. Again, dry off to 2 weeks post-calving. That's how we define it. The basics of dairy cow nutrition, there's a lot of challenges here, and the ones that you pay close attention to are fatty liver, ketosis, milk fever, acidosis, and displaced abomasum, and those are the ones I'll be talking about. There's others like mastitis, retained placenta, laminitis that can be issues during this transition period. You should definitely show up. Retained placentas are obviously happening, but I'm not going to focus that much attention on these. The focus will be here just describing them and letting you know what causes them. So here's a typical graph that you see for all transition cows. How many people have seen or are aware of what NEFA is? How many people have heard of that? So it's non-esterified fatty acids. So basically the fat in our body is basically 3 non-esterified fatty acids attached to a glycerol. And as soon as you start mobilizing this fat, this fatty acid gets cut off the glycerol, then that's called what we call a non-esterified fatty acid or a free fatty acid. So when the cow starts mobilizing a lot of fat, you're going to get an elevated level of non-esterified fatty acid. And it coincides with this reduction in intake here that you see right at parturition. So all cows go down to almost 0 intake for at least a half a day, some cases longer, during this period. So that's an important concept, and it totally mirrors, they're not eating enough here, so they're going to start mobilizing fat. So if I can simplify it even more, here's the fat on the body of a cow, or the adipose tissue. You've got this fat going to NEFA all the time. If the cow needs energy, it's going to mobilize this fat, go to non-esterified fatty acids. That's going to head straight to the liver. Then the liver can burn this fat, and it turns into beta-hydroxybutyrate, or BHBA, and those are the ketone bodies. So ketosis is related to a lot of fat being burned to BHBA, or ketosis. This fat can also accumulate within the liver, but it can also be repackaged, and then it can go to the mammary gland. So the NEFA, as well as this repackaged fat we call VLDL, or very low density lipoprotein, can go to the mammary gland and produce milk fat. So where a lot of this metabolic issues are happening is based around this liver. Either too much of this non-esterified fatty acid is being burned and creating elevated ketone bodies, or too much is accumulating within this liver. So this is the accumulation of what a fatty liver would look like. So this is the fatty liver up here on the top, and this is what a normal liver looks like. So if you have a really fat cow right before parturition, you're going to have a liver that looks very similar to this compared to that. And when you consider that there's actually 2,000 liters of blood flowing through this liver of a dairy cow every hour, the functionality of this liver is going to be completely different, and it's going to influence the overall production of this animal. So I got a question for everyone. What cow would you rather calve out? So this is, I would say, a cow that's just above a 2.5 body condition score. This one would be closer to a 4. Would everyone agree with me or anyone disagree? Which one do you want to calve out on your farm? Yeah. So put hands up if you want to calve out this cow. Yeah. Hands up for this cow. Yeah, this is the cow that you would want to calve out rather than this one. A little bit low in condition, but a lot of work from mainly Cornell University and Penn State show that these cows that are graded at body condition score of 3.25, so this would be on a higher level than 3.25, have higher non-esterified fatty acids in their blood, or NEFA, and produce 1 to 3 kilograms per day less milk at 30 days of milk than cows with a body condition score of less than 3.25. So you might think that these cows need a lot of energy and it's okay to go to a 4 body condition score, but it's actually better if they're closer to a 3. So a lot of that's another issue outside of fatty liver, which I've already discussed, is ketosis. So you're going to get too much of this NEFA being burned in this liver for energy to produce these ketone bodies, which actually the cow uses for energy. So an accumulation of ketone bodies in the blood is an issue, and it happens a lot during this transition period, in particular the first month after calving. And you need glucose for tissues to process the ketone bodies, and inadequate glucose for this brain will impact brain function. That's why cows that are ketotic are a little bit unpredictable. So when I don't have enough food, I am unpredictable. These cows, you can actually spot them sometimes if they're severely ketotic. They just won't be behaving in a normal fashion. So solving this issue is really proper body condition score, and that's a solution to a lot of things during the transition period. So making sure your cows are calving out at a 3 to 3.5. And glycogenic supplements such as glycols or anything that will produce glucose in the liver, that's what you want. Choline sometimes, helping with liver function, and then rumensin as well. That will all help to reduce the incidence of ketosis. So monensin will favor actual ruminal fermentation of one VFA that will produce more glucose in the liver when it goes to the liver. Another important thing I see on a lot of farms are the keto meters. So how many people have a keto meter on their farm? So 3 farmers here. How are you using them on every cow or just problem cows? Just problem cows? So how much did this keto meter cost? Do you remember the price of it? Yeah, I think it's around 150 bucks, and each strip costs probably less than $1.
You can't buy that one.
You can't buy this one, so this is an old one. Yeah, but
The meters are only 45 bucks.
Mm-hmm.
Strips are, I think, 250 a piece now.
Okay.
Can you still buy that meter?
Yeah.
Well,
They've changed it around now, but they are making them again.
Okay.
But we get them at Shopper's Drug Mart now. I don't know if Costco still sells them.
Yeah.
But Rexall actually, Rexall gets them in for me.
Yeah.
The meters are 45 bucks and then it's 25 bucks I think per 10 strips.
Okay. So it's not that much of an investment to get a level of where your cows are at. And I'd recommend not only doing cows that have true clinical ketosis just to confirm it. You can probably visualize it, but just to double check to make sure that that's the issue, but even subclinical ketosis. So clinical ketosis can be like the readings would come out at around 2 or above. Subclinical would be 1.2, and the units are millimoles, but you don't need to know that. But 1.2 is a subclinical, and you're going to see that in almost 50% of your cows at certain points during the early lactation.
How many days of milk would you be checking for this?
I'd be checking in the first month of, a couple times during this first month, yeah. So if you're interested, this is a really good tool to use. And, pardon me? Yeah, you could. So you can come talk to your vet and your nutritionist and come up with treatment programs if you have a cow that comes out as a clinical ketotic cow. Instead of the guesswork being, oh, does this cow have ketosis or does it have a displaced abomasum? Sometimes they go hand in hand though. you can actually, define it a lot more before you start treating them. So it could happen, it could be something else like acidosis or something, you just don't know. So it's a good way to do it right on farm. It's really easy to use. A lot of my students know how to use it, so I'm sure all farmers know how to use it. That's for sure. My students are actually quite good, but I just like making fun of them from time to time. Another issue is milk fever, as everyone knows. And normal plasma or blood levels of calcium are around 8 to 10 milligrams per 100 mil. But levels when you're seeing a downer cow can go 6.5 to 4.5 milligrams. What we're finding now is there's actually subclinical milk fever, and that can be ranges in between this 8 to 10 and the 6.5 to 4, so somewhere around the 7. You can even have cows go off feed a little bit. They won't go down, but it is subclinical. These levels will definitely go down. So the high demand for this calcium in the early onset of lactation obviously does this. And you can intervene by giving calcium, obviously, but the biggest thing here, and I'll hit home again on this next slide, is the potassium in your pre-calving diet. So you want to, some people decrease calcium intake in the close-up group. Some others actually feed more of it. You just want to stay away from this window of being in the middle. But calcium is really not as important as potassium when it comes to milk fever. And I'll explain why later. Some people also feed anionic salts. That was really popular about 20 years ago, but it kind of went away just because the anionic salts, the cows don't really like to eat them. So cows would be going off intake during this close-up period, but now there's new anionic salts out there and they're a lot more palatable for cows, so it makes it a lot more feasible to feed them. So what you've probably heard your nutritionist talk about is DCAD. When it comes to dry cow diets. And what it stands for is dietary cation, so the positive charged elements, and then the anion balance. And basically it's the amount of sodium and potassium minus the amount of chloride and sulfur. And you want it to be negative. You definitely want more of these anions or the chloride and sulfur in the dry cow diet. So you don't want a positive, which you would see in a fresh cow diet or a lactating cow diet. You want to see a negative. That's really important. And you can do that largely from just not feeding a lot of potassium to your dry cows. So you decrease potassium in the ration, and that's pretty important to just monitor potassium. Test it. If you have a forage above 1.5, you shouldn't be feeding it to a dry cow, especially a close-up dry cow. And everyone talks about why it's important. What's this going to do if you're feeding a low DCAD? It's actually going to lower the blood pH. And what happens when you do that is the cow starts mobilizing its bone, and some phosphates go out of the bone, and that actually balances the pH. So what you're doing with a low DCAD diet is getting that cow ready to mobilize reserves from the bone, which have calcium in it. But it's basically to neutralize this low blood pH that you're feeding through a low DCAD diet. So it's basically priming this cow right before parturition and calving starts to get it used to mobilizing bone calcium. This is what I studied during my PhD. This is the most simplified diagram I can find of the rumen. So we have everything coming in here through the esophagus. We have our rumen bacteria digesting fiber and starch. We have everything moving lower to the lower gut, but it's a lot more complicated than that. And a lot of the times, especially in early lactation, is where you're going to see a ruminal acidosis. And the subacute form of ruminal acidosis is what you commonly see in the dairy industry. In feedlots around here, you're going to see the acute acidosis, but we typically see the subacute acidosis. And that's when pH is less than 5.6 just for a couple hours during the day. It's associated with poor milk production, decreased rumination, cud chewing. Lame cows, it's been associated with laminitis as well. Erratic dry matter intake, so one day a cow will eat a lot, the next day it won't eat as much. Digestive upsets such as DAs, and also milk fat depression. So here's a rumen pH of a cow. that was suffering from what would be defined as not a subacute, but an acute ruminal acidosis. So any guesses when this cow was fed 3 meals of grain during the day? Just tell me when you think the cow received it. So this is the morning meal right here. pH goes down, then it comes back up. Probably drank some water here, now it's above 5.6. Here's the second meal of the day, down, comes back up, and here's the third meal of the day. Then it goes down to a level, and it's hard to get it back up. These levels are easier to get up above 5.6, but when you go down here, it's going to take several hours to get it back up, even if the cow's not on any feed, even if you feed that cow a lot of old first cut hay. It's still, when you reach this level around less than 5.2 to 5, that's a really difficult point for this cow to get back up. And if the cow can't get back up in the morning, it's going to go off feed. In this particular study, even though this cow went back up, it went off feed. So what's absorbing all these acids in this rumen is the rumen tissue. So how many people have seen the rumen tissue of a cow if you open it up? So this is what you would see, basically thousands of these rumen papillae. So they're kind of like villi, except a lot larger. Some of them can actually be as large as the tip of your finger. This cow has thousands of them. It kind of looks like a rug, and they're absorbing all the acids from the rumen through this. And this is a cow that had a really severe acidosis. As you can see, there's some blood here and some of the rumen papillae. But all these acids that cause acidosis are coming from the rumen wall. So this is a study I published in a Journal of Dairy Science just showing a cow during the far off period. This is cross sections of rumen papillae under a microscope. This is actually where all this absorption is happening. And this is a very healthy papillae. But even the first week and even continuously on a 6-week past lactation, you're going to see these cells opening up, and this barrier is not going to be as strong. So you're going to actually have microbes penetrating through this epithelium and going into circulation, and that can cause whole animal inflammation. And this is a typical commercial diet, what you see. So this is happening a lot of the time. So basically, if you're not adjusting these cows to these rations in a good way, you're basically punching holes in the cow's gut. And through these holes, a lot of microbes can go through, a lot of toxins, and it can cause a lot of problems with the cow. So how do you solve this issue is make sure that you have adequate fiber in your diets, in particular effective NDF to keep the cows chewing and producing saliva, and reducing sorting of the TMR, so making sure your moisture of forages are correct. Same with the moisture of the TMR, you want it as close to 50% as possible. Some people are going higher these days, 55% water in a TMR, but making sure that it's not too dry is probably the most critical. Then proper adaptation of lactating in cow rations, and poor feed bunk management is a big issue. So the biggest one you see is inadequate bunk space and irregular feeding schedule. You see this everywhere around the world. What I've noticed since moving, in particular in Western Canada, you see some of this. At least I suspect some of this is happening on a lot of farms. I'll explain a little bit more why when I show some pictures of some farms. This is another digestive upset. Does anyone spot the transition cow problem in this one? I found this, when I saw this one, I was amazed that it actually showed up like this. But yeah, 2 cows with displaced abomasums. This is in a fresh group that was completely overcrowded. So these cows didn't have a lot of access to the feed bunk. They went off feed. Also, the lactating cow diet was really high in starch. So those 2 triggers caused a lot of displaced abomasums, just cows not eating on a routine basis. That's where you can spot 2 displaced abomasums here. And what it looks like is basically this abomasum, which should be right here. It gets a lot of different particles of corn, starch in it, starts fermenting rapidly. There's gas buildup, and then it goes all the way to the other side, and you have to pull it back in these surgeries. And sometimes it can become inflamed as well. It's not just the positioning, but it can be inflamed, and that can actually influence the cow's digestibility of feed in the future. So it's good to solve it without surgery. If you can do a rolling of the cow, that's the best. But sometimes you obviously need surgery, and preventing this problem really comes to bunk management and making sure you're not overfeeding starch and making sure that you have enough fiber in there in the diet. So that's basically the basics of transition cow nutrition. Is there any questions before we talk about some new stuff that's happened in transition cows in the last 5 years? Any at all? How many, like, what's your incidence of all these? Like, how many people are, what's the biggest issue right now on your farms? Is it milk fever? How many people struggle with milk fever these days? Any displaced abomasums? Retain? Yeah. Does it go in phases, or is it?
It's not normal, so
Yeah.
had some problems lately.
Yeah. And typically when you get one of these transition cow problems, you're going to get others too. They're all related. If a cow, especially if a cow goes off feed, you're going to get a whole bunch of other problems. And sometimes you'll get an acidosis before a displaced abomasum. You'll get a displaced abomasum before you get a ketosis. You'll get a ketosis before they even get a displaced abomasum. It can happen in several different combinations, but one of these issues typically means that you're going to have another one happening at the same time. So this is obviously a huge part of the research programs in dairy cow nutrition around the world. And I'll just talk about some new concepts that have come out in the last 5 years related to this topic. So I'll talk about controlled energy intake prepartum. That's kind of related to what Jim Drackley, who's coming to our calf conference, that's what he was very famous for. Decreased starch immediately postpartum, and then some new stuff on dietary fats or polyunsaturated fatty acids. So I'll start with controlled energy of intake, and we'll just spend 10 minutes on this. So obviously this cow on the right is what you really want to avoid. But if you're feeding too much energy, and let's say you have a 1-group TMR, and the energy is too high, or even a 2-group TMR with a close-up diet being too hot, you're going to get cows that look like this. So this is typically, this is a cow's, what you're feeding them with dry matter intake relative to calving here. And in this particular experiment, they tested, feeding a close-up diet, so you're kind of steaming up these cows, and that's what it would look like. It'd be actually over 150% of what they really need. That's typically what a close-up diet is balanced at. And then this is kind of a severe controlled energy intake diet, and it's 81% of what the cow really needs at this point. But ironically, even if you're underfeeding these cows prepartum, they actually eat more postpartum, and they actually milk more too, because you're not going to be running into these issues like fatty liver and ketosis. So in some ways, it's better to be like this. What to feed postpartum, though, is really where a lot of this research has been focused on, including Masahito Oba at the University of Alberta. He's done a lot of work in this area, and he's got another experiment starting this year that will go for a year, looking at what you feed this cow. So what are you feeding this cow right now? Say they give birth on your dry cow diet. Hands up if they go straight to a lactating cow diet. So that's typically what's done. Yeah. There's some farmers that are feeding a lot of hay for the first couple days. Maybe they have a fresh cow group. But typically you throw them right into a lactating cow diet. So this is some interesting work out of New York State that just came out. They did an experiment with 72 cows, and they fed, and these are all fresh cow diets, a low starch diet. So for the first 21 days, and then also 22 to 91 days. So very low starch, not very low, probably around, in this particular experiment, 18%. A medium, then high, so you're getting around 20% starch here, and then close to a 25 here, and then a high, which is close to 25, and then also 25. So the results from this study are pretty interesting because these cows that were fed the high actually had the less intake, largely because the energy density was more. These cows fed the low, low, and the medium high we're actually eating more. In particular, the lows, we're eating more in this first 3 weeks after calving here, which is, when you translate it into overall milk production, these cows fed the low and the medium high actually had the most milk production. So when you think that these cows need a lot of starch, they need a lot of energy during this first period of lactation, they definitely do need the energy. But sometimes it's too much of a good thing, and it decreases their intake, and that will lead to erratic intake behavior. You might have more acidosis in this group where there's a lot of high starch. And ultimately that will cause other health problems and reduce overall milk production. So a lot of the new studies coming out are really showcasing that cows do better if you don't transition them straight onto a really high lactating cow diet. If you give them a medium diet or a medium level of starch before hitting them with more starch and energy later on in lactation. But this all comes back to rumen fermentation, and I'm just going to spend 1 minute on rumen fermentation and explain it to everyone. I'm sure some of you have already heard about this, but this is a micrograph I took of a piece of hay. This is actually stuck to the rumen wall here, but here's some bacteria, and they're chewing at this piece of hay. And this is what an image of microbial fermentation looks like. So these bugs really close to this hay, and they're turning this really complex carbohydrate, which is essentially a bunch of sugars or glucose attached to one another, into 3 main, what we call volatile fatty acids, or VFAs. You've probably heard your nutritionist talk about VFAs. And the number 1 VFA in the cow is acetate. That's when you're going to see most of it is acetate, and it's used for energy throughout the cow. You have propionate, which goes directly to the liver, and glucose is produced from this propionate. So this is very efficient right here. And then a smaller proportion of butyrate, and we'll get to butyrate here. So basically, you want to do anything you can to increase the proportion of propionate to maximize the amount of energy that this cow is getting in early lactation. So high grain diets typically do that, though. There's ways of doing it in a healthy way. A monensin would be a really healthy way because it's actually pushing more of this glucose to propionate. But what's not so good about propionate, and this is work done by Masahito Oba at the University of Alberta, and in this study he infused into the rumen of these cows acetate or propionate, and this propionate is actually reducing overall intake in early lactation. So in a way, you want really a lot of propionate, but too much of a good thing in a dry cow, in a fresh cow, can actually reduce intake. And that's one of the mechanisms of what they think is reducing intake when you're feeding these high starch diets immediately after parturition. Some other diets, you're probably seeing a lot of sugar or whey permeate being fed to fresh cows. And a lot of that is because not only propionate, but a lot of scientists think that if you increase the amount of butyrate that's being produced in the rumen, you're going to have more rumen development. So actually butyrate can increase the rumen growth. And if you increase the rumen size, you're going to get more absorption of these acids. So you're going to get more energy out of the diet. Then you're also going to get less acid accumulating in this rumen. So you're going to get a decreased ruminal acidosis. So this is what happens in dry matter intake, impact of replacing starch with sugar in the first 28 days postpartum. And this is work that was done at the University of Alberta. So if you add sugar, this is postpartum, you're going to get more intake. So what they think is going on is not only is you're increasing the amount of microbial fermentation, but you're also indirectly increasing the overall size of the rumen and its absorptive capacity. So that's why you're going to see a lot more fresh cow diets with sugar or whey permeate, probably more so whey permeate just due to the cost, which is essentially lactose. So very simple and inexpensive sugar. Another thing that's kind of new is feeding fatty acids that are not saturated. They're called polyunsaturated fatty acids. Basically means that they're missing They have double bonds within this fatty acid structure. So you find them in vegetable oil, linseed, canola, some soy. There's one product called Megalac R, and that means reproduction, but it's just full of polyunsaturated fatty acids. And the one that you always hear about is called conjugated linoleic acid, but I'm just going to call it CLA. But basically, all you need to know is that it's a lot of vegetable oils that people are feeding to fresh cows. And here's why. And it's predominantly because these vegetable oils are really good at decreasing over milk fat synthesis. So this cow is actually producing quite a bit of milk fat in early lactation. Some values can even be as close to between 5 and 10% in the first week of lactation. But if you feed a lot of this PUFA, you can actually shut down the synthesis of milk fat in the mammary gland. So here's an experiment where they fed some polyunsaturated fatty acids in the form of CLA versus a control. And this is milk fat yield. So these control animals have higher milk fat post-calving. These CLA ones, or the PUFA cows, these vegetable oils, have less. So this isn't a good thing for the entire lactation, but what they're arguing is this could be a good thing in the first parts of the lactation or the first weeks of lactation. And this is milk yield in these cows that were fed these polyunsaturated fatty acids are actually higher in the first weeks and days post-calving. And why this is happening is because their milk fat's a little bit lower. So this energy that's supposed to be going into the milk fat is then going into overall milk production. So this is a good way of tricking the cow, kind of taking a little bit of weight off the cows, or a little bit of the workload off this cow by decreasing milk fat, and more of that energy can go into producing milk. But then I would be switching it so that you don't have milk fat depression for the entire lactation. But if you have a fresh cow group, that would be a decent approach, as well as feeding sugar to the cow. Here's the energy balance. So there's actually no difference in energy balance because you're not producing as much milk fat when you're feeding these vegetable oils, but it does stay the same. So they take that milk fat, put it into overall milk. And there has been some evidence showing that these PUFAs can actually increase the probability of pregnancy and are good for the reproductive tract. And that's what Dr. Dr. Ambrose, who is at the University of Alberta, studies a lot, and has shown that a lot of these fats, particular vegetable oils, can help with reproduction. So that's another reason why it's becoming popular. But I wanted to know right now how many people are feeding their cows like this, a far off dry cow, close up, and then a fresh cow. Hands up if this is what you're doing. Okay, so someone has a fresh cow group. And how many days or weeks do they stay in this fresh cow group? 20. Yeah, so that's rare. It is a pain making 3 TMRs and you're not even getting to the lactating cow. So you need a lot of cows to do this. And that's why you see a lot more farms moving to this one group. So how many people have a one group TMR for their dry cows? Yeah. So as nutritionists, we keep on flipping back and forth. This became very popular about 10 years ago, largely because of what Jim Drackley was doing, who will be here in Alberta in June, just feeding more controlled diets. But you still see that they both can work as long as they're managed properly. You just have to be very careful about the energy value here and also their intakes and making sure they're very regular here. Well, all throughout in both scenarios, but it's very critical here. And for the people not feeding fresh cow diets, what's the reasoning behind that other than facilities? Let's say you had the perfect transition cow barn. Would you feed a fresh cow diet?
Maybe.
Yeah, maybe?
That's the problem, is that I cannot separate the groups that.
Yeah. So I think that you'll see more of these coming in. If you have a larger herd, I think it's a lot more feasible because you don't want to be making a mix for 5 cows. You'll probably cause a lot more problems if you're making these very small mixes. So I think they both work. The movement throughout the entire industry is going to a one group just to keep it simple. And I think you've got lots of straw and lots of corn silage in this area to do some really good one groups. You don't really need straw and corn silage to do it. All you really need is a low potassium forage and some, controlled, not so hot forages, then it should work. I'd like to finish this with some pictures that I've collected over the last 10 years of transition cows. And this is the biggest issue that I see in transition cows. It's actually not the diet at all. The diets are pretty straightforward. Any nutritionist can balance a diet on paper to look perfect. Where it all kind of falls apart is the environment that you put the cows in. And this is the number one issue of overstocking. Over 100%, I would not recommend. If you could get to 90%, that would be the best during the dry cow period, as well as post-calving. I would never go over a stocking density of 100%. And there's a lot of data that will support that your cows will go down in production if you go over. It's actually ideal if you're at 90%. But even in new transition cow barns, it really doesn't take that long for them to become overcrowded. And this is, I think, one of the biggest issues in all dry cow, transition cow management. Here's just some numbers showing overall dry matter intakes in pounds. When you have a stocking density of 111%, you go down to around 100, still quite low. Then you push them below 90, and they stay pretty relatively constant here. So just shifting from like a 90, from a 100 to a 90, you're gonna get a couple more pounds of intake in these cows. And why you wanna drive this intake, especially if you're feeding a low energy diet or a controlled energy diet, you wanna get as much feed inside that cow right before it gives birth, because it's not gonna be eating for about a day. So you wanna fill that entire rumen full of a high forage diet. Ideally straw, because it will stay in that rumen for a couple days. But if you're, you just wanna make sure that they're filling up, and this is one way to really make sure that even the day before calving, that they're consuming their optimal level. I think also what's happening is you're going through these, or a lot of the dry cow diets are low energy, but then you have pieces of TMR that are a couple inches long. This particular case, you could find some that were close to 6 inches long here. And this is what's going to be happening is the cow's going to be sorting through this diet, and they're just going to be taking the grain. So what you put through the cow on paper is not what they're going to be consuming, in particular in this course. And when it's coarse like this, it's going to take them a lot longer to process it in the rumen, and it's going to take a lot longer to go to the lower gut or the intestine. And when you have that happening, then the cow's not going to be eating as much because they don't have enough space in their rumen. So that's why even similar diets, these diets are almost identical from a nutritional standpoint, but the cows on this diet, where it's cut a lot more finely, will be eating about 2 kilograms more of their feed. So this is a pretty big issue. And now there's some research looking at the transitions of a dry cow diet with respect to particle size to a fresh cow diet. A lot of the cases you have a dry cow eating something like this, and then we transition them onto a lactating cow diet that's really fine. But I think if you can smooth this transition here, if that's all you have to feed your dry cows, they will do better during the dry cow period. But even dry cows, they will eat a lot more and do a lot better if you feed something with a chop length of 2 to 3 inches for the larger particles, and as consistently as you can get this chop too. So some people say, yeah, my chop's at 2 to 3 inches, but they'll have some at 6, some at 1, and that's a big issue too. They'll still sort quite a bit. If you can make sure, ideally, if you can get a hammer mill, that's the best way, but there's some tub grinders that can do a good job, making sure the cut and the chop is really consistent. And the best way is to get your nutritionist out and do a shaker box. So how many people do shaker boxes on their farm? Yeah. How many people get the nutritionist to do it? That would be a really good approach. Sorry, Dan. But I think it's necessary to do just to keep on top of it. And what you would want in a typical lactating cow diet is less than 10% in the top, so these large particles, and then about almost half of it going to the small or the bottom sleeve and then the middle sleeve here. But this is the consistency you'd want in a lactating cow diet. And it's important to check it A good way to check this is feed do it to what you just put in front of the cow right after you mixed it, and then pick up all the orts or what they've left over 24 hours later, then do a box. And you'll see a lot more of this the next day. So your cows are actually not getting the proper diet. Even if it's mixed properly, they're always going to be sorting against this. But if you're not doing a good job with mixing and chopping, this will become alarmingly obvious if you do a shaker box the next day. So it's a really good to do it, not only in everyday management, but especially when you're making forages. I would be doing shaker boxes on a routine basis to make sure, especially if you have custom harvesters that are going way too fast, you'll probably get a lot more here. So just to keep on top of it. And that can totally influence your bottom line for the entire year. So even chop length. This is a transition cow barn in Minnesota. I was actually not at this barn. This is some images I got from a professor in Minnesota. But I've heard about this barn a lot. What I like about this, it's about 20 years ago, they had the all-in, all-out idea. This is one of the first farms that have been doing it. So every single transition cow pen, even at far off, at the dry off, they're dried off together and they stay in that pen with their herd mates until they give birth, 60 days later. So they don't have to interact with other cows. What happens a lot with the far off, close up, fresh, typically you have a move in between the close up and the fresh, is that you're moving cows constantly to a different environment. Each time you move a cow, there's gonna be stress. It doesn't matter what the group size is, but the stress is intensified if you have a stocking density close to 100%. But every single move, they're gonna become stressed out. So this is a really good approach. If you can minimize the number of changes in the environment, you're gonna have better transition. And I think this is one of the most extreme situations of this, because not only are the cows dried off and calved in the same group, all these groups, they do go temporarily into a calving pen though, which is disinfected after every calving. But what's interesting about this farm is that all the calves that come from that group also stay together. So this is a pretty extreme situation that you wouldn't see on a lot of farms, but you can kind of understand where they're coming from and their thinking process behind this. They do see benefits of keeping the cows together, but also the calves together in these environments. You need a large herd to do this. This is a farm called London Dairy. They milk over 1,000 cows in Ontario. And this is their lactating cow. I think this is their far off. This is their close-up and fresh cows. All their fresh cows get hay for the first day. What is kind of interesting for this particular barn is they all calve out into this group. And this group is right beside, if you go a little bit further, they have like a double 20 or something like that, some massive parlor, but they also have this very small parlor right beside the pen where their cows give birth. The reason there is because they don't want their cows to walk that far as soon as to collect colostrum and transition milk. And they want them to be resting during this time. So even their attention to detail is they don't even want a cow to walk to the parlor for at least a couple days, just to conserve their energy, make sure they're very comfortable. They're on bedded packs a lot. But even in other scenarios, this is another farm I worked with in Ontario. They actually brought the milking machine into this transition cow pen where they all gave birth, but this cow was actually milked right into the pen instead of going to the parlor. So I think anything you can do to minimize stress if you've got the labor will help. In that case, before that's 1,000 cow dairy, the labor's pretty intensive. They're still thinking, this is a good management tool. But I think that this is a great idea to keep minimize the number of changes in the environment, but also not to really push this cow immediately. This is another barn, same area of Ontario. This is just their cows right off, really just before this cow's about to be dried off. They're using a lot of sand bedding, which is something that I'm not seeing a lot of in Alberta. There's about two farms I know of, Vermeer's and also Gert Shriver's just put up a new one, but I don't see a lot of this. But I think when it comes to cow comfort, it's by far the best. When it comes to machinery comfort, no, it's by far the worst, but I think that you're gonna see a lot more sand bedding just to improve cow comfort. And not only lactating cows, but also dry cow setups too. But on this farm, they have their fresh cows calving out here, and they're right beside the sick cow pen, which you see all the time. And a lot of the fresh cows, as soon as they give birth in here, are moved with the sick cows. Some of these cows have mastitis, others have ketosis. This looks like a cow that's has some form of displaced abomasum. But basically, you're seeing a lot of mixing of these fresh cows right when they start their lactation with sick cow. So if there's a mastitis case in here, these cows that are really stressed out right after giving birth are being mixed with all these pathogens. And that's the last thing you want to do, or put that kind of stress on a fresh cow. So if you can, and I know a lot of facilities can't do that, I'd be separating your sick cows with from your fresh cows. But you see that in a lot of setups. This is another unique setup. I just kind of wanted to show diversity where these cows were actually milked, but also during their entire dry period, they were in a tie stall. They actually calved out here. This pretty famous breeder called Claynook Farms in Ontario, but it just shows you a different setup. And the reason why they wanted not to have these transition cow groups is because they wanted these cows to be adapted to their 160 cow tie stall that they have. They didn't want them to go from group environment to individual all the time. So, you know, you can argue about this. It's probably not the best from an animal welfare standpoint to keep them in a stall their entire lactation, but their cows are milking phenomenally well. And it was just, I found that interesting that they wanted to minimize the actual movements. This is our home farm. This is where our far off dry cows were. But then we moved our fresh cows into pens where they gave birth. We just wanted to minimize the number of different moves, so they would give birth in this group. But what you see a lot of is these cows going into smaller pens for the calving. And more and more research, especially coming from Canada at University of British Columbia, is showing that this really isn't the best environment for a cow to give birth. They kind of like to be secluded. So like these small box stalls that you see a lot in cows giving birth in here, it's actually not what they want. If they have an opportunity to get away from the herd, they're going to take advantage of that. So you see this new research coming out of UBC where they actually have these calving boxes, and you're seeing a lot of farms putting them in, where the cow can actually go to seclusion to give birth. If you offer that into a big freestall or a big bedded pack area for your dry cows, your cows are all going to calve there. I would say 90% of them will go to the calving box because they want to be separated. So I think the way that we've actually been calving them out, putting them into small stalls, is not what the cow wants. So you see a lot of differences in new barns and the designs in the future based on this research. So I only noticed that one person fell asleep, so I'm really happy about that. It was Dan. No. But I wanted to just summarize everything, and we can talk. I'm here until 6 a.m. tomorrow morning, so it doesn't matter how late we stay up. But the transition period is really what will make or break the lactation. So whatever happens, even during the dry cow period, even far off, will have a long-term impact on the lactation. And transition cow problems are all related. So if you got a fatty liver, you're probably going to have ketosis, milk fever, ruminal acidosis, displaced abomasum. They all go hand in hand. Once you get one, you're probably going to get another one. And maintaining consistent feed intake, but not excessive feed intake, too much energy to get fat cows, is really important. So feeding a really consistent diet that's low in energy, where you can maximize how much is going into that rumen, will stay in that rumen just before the cow drops off in intake right at calving. And then there's really a lot of ideas for fresh cow diets. One of them is feeding vegetable oil or PUFA. Controlled energy intake is the number one, so not overfeeding energy here. And then feeding, not feeding excessive starch, and feeding things like sugar to fresh cows. So with that, I'd be happy to take any questions. And thanks for your time.
Nobody's got questions? Alright, that's a very good job. Yeah, I got a question. We were talking about shaker boxes on the lactating herd.
Yeah.
How should that compare to the dry cow? Should it have the same consistency? The 10, 45, and 50?
It should be a little bit more on the top, just
So
a
you want
tiny,
to build a bigger rumen mass?
just a small, yeah, small amount, but it should be a little bit more in that medium, but really not that far off.
Because you're right, you do see a lot of dry cows with coarser.
Yeah,
Okay.
but they will not eat as much if it's a coarser TMR. So you could maximize your intake if you grind it more. But as long as you've got a good grinder, because then you could run into an issue of having very small particles. But you're gonna see the top two shelves be a little bit more than the bottom shelf in a dry cow diet.
So like example, like today you saw a guy tough grinding straw.
Yeah, that was really good. Yeah. So you can do a good job, but I think that you got to stay away from these particle sizes like this. And sometimes, I remember feeding a lot of dry cow hay to our cows. We weren't feeding a TMR to our dry cows, and I think that's kind of in the mind of a lot of farmers that need these large particles. But if you're controlling your energy and using a lot of chopped straw in particular, or a really low energy hay, it's best to have a small particle size. They'll do better. They'll eat a lot more. Same thing with heifers too. In particular, calves. They'll eat a lot more if it's chopped. Same with lactating cows. So that confuses some people because you think that if you got these long particles going into the rumen, it's a good thing for a dry cow, but it's actually a bad thing because it's going to block intake or passage to the lower gut, and the rumen's not going to be as full. And then you have this big transition in particle size. So we talk about nutrients, but there also is quite a big transition in particle size from dry cow diets to lactating cow diets. That could be another transition for them.
But weren't you mentioning the practice of giving hay to fresh cows?
Yeah, a lot of people are giving free access hay on top of a TMR
Okay.
to just their fresh cow diet. A lot of the people feeding hay still have a lactating cow diet that they go on, but they just keep them on hay for 2 to 3 days. It's very short windows. And this is like where we as researchers, we go to farm and we pick up what's happening on some of these farms that are having a lot of success during the transition cow period. They're not really feeding this hay for a long time. They just basically feed it enough so that the rumen is full. Then they push them onto the lactating cow diet, and they tend to do better that way. But this area of what to feed a fresh cow when it comes to how hot the diet should be, it's everyone is putting them on the hot diet, but I think that if you decrease the amount of starch and energy, they'll actually do better. Which we just don't know right now how long we should do that. The severe circumstance of some of these farms, like Gert Shriver's a good one to look at, where he just feeds hay for a day or two. But some of them actually are feeding a low energy diet for a couple weeks. So at our research farm at the University of Alberta, we're doing an experiment where we're feeding low energy diet for 3 weeks before they go on to a lactating cow diet. When we say low energy, it still has quite a bit of starch, but it's equivalent to what you were seeing in some of those slides. But there is still grain going into them.
So low energy is what, 20% starch?
Yeah, 18. Yeah.
18?
So are you talking a low quality
Listen down there.
or a high quality? Are you talking about a low quality hay or a high quality hay for the fresh ones?
It's anything that's consistent. Yeah, you can have. I would go for a high fiber one if you have a good chop on it. You could feed a high energy hay like an alfalfa hay. That would work too, but I would, whatever is consistent on your farm that you have a consistent chop to is best. It could be straw as well going into your TMR.
No, but if you're feeding hay separate, I mean, like,
Yeah, I would go for a first cut hay. so the whole objective there is to fill the rumen full of hay for that first day or two before they hit a lactating cow diet. So you can get an acidosis on just pure hay if it's really chopped finely and is really rich, has high in sugars and starch. You can get acidotic out of cows, just to let you know. That's why I would say a first cut hay would be best, as long as they eat it and it's palatable.
But you're mentioning chop it, would you chop it?
Yeah, I would chop it.
Not too bad.
Depends how, if you're gonna feed it longer than a day or two, I would chop it. If you're not, then I would feed, then I don't think it's that critical if you're just gonna try to fill the rumen full of hay.
So how far does your research go on metritis?
So metritis work is typically done by Dr. Ambrose, who's at the University of Alberta. And I think he's done some work in this area actually. But metritis is not something that I study. I'm doing one study in another year or two. So we apply for the funds now in order to do it in 2017, 2018, related to metritis with the University of Guelph and feeding trace minerals.
Yeah.
But, and also the group from Calgary does a little bit of work in metritis. But their focus is mainly laminitis and Johne's disease right now.
Do you have a question around metritis, or are you
Yeah.
interested in this research?
Yeah.
Oh,
But I think decreasing, if you can maintain intake in the first weeks of lactation, you're gonna have improved reproduction. And also the retained placentas are associated with obviously metritis, but retained placentas, a lot of people think that that's a nutritional issue. So what they do is pump a lot of vitamin E and organic selenium to the cow during the dry cow period. There's actually no evidence showing that it will decrease retained placentas. I think retained placentas are more of a stressful calving. So if you have twins, you're probably gonna have a retained placenta. And I think that's the critical part rather than the diet. And a lot of people look at retained placentas are because I'm not feeding enough vitamin E and organic selenium. And most dry cow diets, you're getting above what you really need for both. And they're not really limiting factors. If you've got a really good feed company, all the feed companies are doing that. Another, I didn't mention this, but I saw it on a farm today for something relatively new. It's been around for a long time. We've known how it works, but feeding zeolite to cows during this fresh cow period. It's quite expensive though, similar to cost to, let's say, an anionic salt, but it does help with calcium metabolism post-calving. So I saw that on a farm this morning, and I noticed that there's a couple farms around, well, a lot of farms around Western Canada feeding zeolites, and same with Eastern Canada too. But it is quite expensive.
What's the
I forget what specific ones. Pardon me? So basically there's this, it's a clay that will bind different toxins in particular, but different minerals, and that should influence your overall DCAD diet later on. So you'll see that more and more, but it is quite expensive to do. Same with DCAD diets are
and
pretty
this one
expensive.
binds calcium, correct? And then it
Yeah, so
acts
we'll
the
bind,
same.
yeah.
So we feed a low calcium diet with that as well.
Mhm.
It binds the calcium that's in the forages and whatnot.
Yeah. I think it's important to stay away from a medium calcium diet. So what I'm saying is between a 0.7 and a 0.9. But you see some close-up diets at 1.1% of the total diet is calcium. And I think that's okay as long as your potassium is low. So definitely all forages below 1.5, really important number to know. But if you can get your diet close to 1, and what is potassium coming in on a lot of the hays in this area?
Any alfalfa hay is going to be 2.5.
So 2.5,
Above your Timothy's, most are between 1 and 2.
yeah. So
reports.
even a Timothy can come out above 1.5 pretty easily. But if it's best to, you can find a lot of them at between 1 and 1.5. That'd be a good dry cow diet. That's why wheat straw is so popular, but you still have to watch some of them as well. Don't assume that all wheat straw is low potassium.
What about calcium supplement right at County?
The boluses? Yeah, I know a lot of farms looking at them and they're doing experiments now. I know a couple farms, like there's one at the University of Guelph, Summit Home Farms, so the Lowith brothers, who are in Ontario, they're doing an experiment on that, but the results haven't come back. They swear by them, and the cost of them, it's basically like a bolus of limestone that you're giving this cow in the rumen. So it will go to the cow gradually, which is what you would want. You don't want this huge spike in calcium through the cow. So they look promising, and this is just all anecdotal, but it looks like it could potentially work. But they'll find out in another year or two once they finalize the study.
I've been using that one a year.
Yeah. So it just came on the market about, the first time I saw it was about 2 or 3 years ago. Yeah. But what's the cost of one bolus? $10. Yeah. So that's really not that large of a cost. When you consider what's in it, like that's, it's basically limestone. But I think for an insurance for $10, it's something, if it works, then I would see a lot of farmers using it.
Most farms are using it already.
Yeah. There's just not a lot of peer-reviewed work on it, but usually we just kind of, like if farmers are using it and having some success, it's probably working. So, yeah.
So for ketosis, an extreme ketosis case, do you have a protocol that you?
So, no, I don't, because I can't keep on track of what people are doing. I would do it more as to see if ketosis is occurring, and then try to alter your dry cow diets in your transition period. But yeah, it would be like glycols, drenches. And then there's some debate that if you drench a cow a lot, you're just basically pumping them full of glucose precursors. A lot of that's actually coming out in the urine, because they'll reach a level in their blood where it's actually above a certain threshold. It's around 8 millimolar of blood glucose in a cow. It will go into the urine, and you will hit those parts. So that's the only thing I don't like about drenching. I would say drenching is your last resort. I would do anything I can before getting a ketonic cow, but obviously if you have a severe ketosis, you have to drench. And the protocols are very different depending on the vet. So how many veterinary clinics are here in this area?
Two dominant dairies.
Yeah,
There's much more, but two dominant dairies.
yeah.
Clinics.
So I would follow your veterinarian's protocol on that, but typically it's a glycol drench that you would give them. You can give like different glycol ingredients into the dry cow diets. They're another very expensive way of doing it. The good thing is that it's more stable, but the bad thing is they cost over $1 per cow per day. Do they work? No evidence has shown that it works well feeding it through a diet. There's a lot of evidence showing that you can get, at least reduce the level of ketosis through a drench. But I think the key point is to avoid it, because I think that really disturbs the cow when all of a sudden their blood glucose spikes like that. That really confuses them with what's happening. But how many people are drenching here? Yeah, when you just need to. How many people? There's some farms are doing routine drenches regardless of ketosis. You see that a lot in the U.S., where certain cows at specific time points post-calving are getting drenches. I saw that a lot in the U.S. There's no one doing that? Yeah.
What are they actually sticking in the drench then though?
Different glucose precursors. So some cases it can be just sugar. Other cases it can be like what's called now you're getting more people feeding glycerol, which is another precursor too.
They're drenching all their fresh cows?
Yeah, there's some herds in the U.S. that I've seen that drench every single fresh cow gets a drench.
I always thought that if you drench for sugar was a bad thing for the rumen, because you're killing a lot of goats. Is that any truth to that, or?
I think that, yeah, I think depending on how much sugar you're giving them to, it could be a good thing, but I think any kind of drench is generally bad because you're gonna be overdosing the cow on a specific nutrient. There could be ways of feeding sugar. I think feeding sugar is a lot better. But, you know, there's certain veterinarians that go around putting corn syrup in the fresh cow water as soon as it, and that's probably a really efficient way of boosting blood glucose right after. But the glucose, if it stays within the rumen, it will be turned to butyrate, and which can trigger the rumen to grow a little bit, but a big dose like that won't really help. Could be detrimental.
Any more questions? Well, thank you, Michael Steele.
Yeah, thanks for your time.